Hi, welcome. I'm Dr. Charlie Ferrer. I'm the founder of Cancer Tamer, and I'm going to tell you a little bit about what that means. So, if you don't know me already, I actually am a clinical sexologist and sex therapist, and you might have seen my shows before on Pleasure with Dr. Charlie and relationship shows where I talk about the various different aspects of sexuality. Well, I've moved on a little bit from there and incorporated a little bit more. And I want to talk to you about Cancer Tamer today. And Cancer Tamer is a new organization that I developed, and it is for individuals who have experienced, are going through, or have had any connection with cancer. The way I look at it is we talk about cancer as it being something that's outside of ourselves, something that we have to fight with, that we have to battle, that we have to survive, that we have to have this major conflict with. And yet we forget that cancer is actually inside of us. It's in our blood, in our body, in our breasts, inside. And so when we tell ourselves that we need to battle, that we need to have a fight with, we forget that our brain and our subconscious doesn't know the difference. It just says, oh, here's something horrible that we need to get rid of. And so we end up inadvertently hurting ourselves. So Cancer Tamer is a new way of looking at cancer. It's a new way of thinking about what we need to do in order to tame that cancer and be able to live with it, because cancer will be with us forever. If you've been diagnosed with cancer and if you've gotten rid of cancer, you always hear the doctor say, well, we can't tell you 100% that you'll never get it. Also, a lot of us are worried about the recurrence. And so instead of worrying about it, let's start living with it and learning how we can better serve ourselves and better address the cancer that we want to prevent. And so that goes into being able to learn how to eat better, learn how to exercise, and all that. And with that, I'll talk a little bit more about that in a few minutes. However, for those of you that are interested, you can always go to our website, cancertamer.org, and learn a little bit more and also ask questions if you have any questions whatsoever. During this program, we will have various different physicians, various different clinicians that will be coming on board to talk to you about the various aspects of treatment. A lot of people think that cancer, once you have cancer, the only treatment out there is chemotherapy or radiation. And that's not true. There's so many different aspects of treatment that you can get, both holistic, both traditional, and new age. And I throw in new age because there are a lot of different aspects of treatment that are out there. For instance, we do have the traditional, which are the chemotherapy, the radiation therapy, surgery to remove the cancer that's been identified and remove tumors. But there's also acupuncture. There is nutrition, there is sound therapy, there's yoga, there's different aspects of treatment that you can get and ways to deal with your body, ways to feel healthier and more vibrant in your life that are also out there. And those are the things that we will be bringing you in the weeks to come about the different aspects that you can try. And we'll just be able to give you a small little snippet of it, little tidbits that you can have. And you will then be able to go out and get more information either from the providers that we bring or doing some of your own internet research. And I will caution you about the internet. I know that when I was diagnosed with cancer, I have stayed away from researching on the internet and actually depending more on resources like the American Cancer Society, cancer.org, Tell Every Woman, and being able to look at those websites and physician websites, because those are the ones that have the information. What I found when I first researched cancer, there are a lot of internet and a lot of websites that talk about cancer. However, what I found in my experience, I'm not saying all of them are like this, but my experience was that I read through this file that said I was only going to live for 2, maybe up to 5 years, and that all these people were lying to me, and physicians and the government and so on and so forth. But if I used their treatment and their supplements, then I would be able to live longer. And so that's why I caution you about websites. Make sure that you go to reputable websites out there, because some of them are just trying to sell you something. And you want to avoid those. The minute they start telling you any negative information, question the source. So what we're going to do here at Cancer Tamer is we're going to be bringing you a lot of information. Also, one of the wonderful things that I heard Chris Carr talk about, and if you don't know who Chris Carr is, she actually does a wonderful book called Crazy Sexy Cancer Tips that I found very inspirational. And she has a couple of books also, Crazy Sexy Juice and Crazy Sexy Kitchen. And she talked about having a friend of hers do the internet research for her. And her friend was able to sort through all the craziness on the internet and only bring her the information that was valid, that was something that she could actually use. So if you have a member of your family or a friend, or you're with an organization that you could say, I need information, can you please look it up for me, so that you don't have to then go through all these hours of research only to find out that they were trying to sell you something. Also, a wonderful resource that I found when I was learning about cancer and getting my life PhD on cancer was the American Cancer Society actually has a lot of information on various different kinds of cancer, breast cancer, thyroid cancer, colon cancer, and so on. And they will send you the information for free. Get that, free. And they'll send it to your home, or if you give them your email address, they'll send it to you on your email. Me personally, I love to have it via hard copy. I'm old-fashioned. I like to be able to make tons of notes and have something actually in my hands so that I can make all my notes, make annotations. And the wonderful thing about that is that when you're going through treatment, you can put down all your notes, write your questions, put them on a separate piece of paper, and then when you see your physician, tell your physician, hey, these are questions that I have, can you answer these? Or if they can't answer them, then ask them, where can you go to get an answer? The other part that we're going to be doing is teaching you how to advocate for yourself. One of the things that I have noticed in this crazy journey of cancer is that most of the physicians are used to individuals, especially women, or their patients, and I have to say I've only seen the women aspect of this because I've been dealing with breast cancer myself. So I've been seeing how they treat women, and not all doctors, but several of the doctors that I've come across tend to treat you as you have this disorder, let me tell you what you need to do, and come back in 3 weeks and we'll treat you again and we'll talk a little bit more. Instead of sitting there answering questions with you, telling you everything that you need to know so that you can address what's going on with you. Many of them are so used to just telling you what you need to know, and then they send you on your way, and they only give you a small snippet of what you need to know. I would caution you on allowing yourself to be led. I think there are 2 types of patients in this world, regardless of whether it's cancer or any other disorder or any other kind of necessary medical care that you need. There's 2 kinds of patients, just like there's 2 kinds of people, and they both fall into these categories. The first category is someone who will turn around and be very vigilant, be very outgoing, want to get as much information as possible on their disease, on what's going on with them, and getting information and looking it up and then going back and talking with the doctor and advocating for yourself. The other type of patient is the one that waits for you to tell them what to do. And there's nothing wrong with either or. The only thing that I would caution is if you're waiting for the doctor to tell you everything or the nurse navigator to tell you all these things that you need to know, you're going to end up missing a lot of information because, again, they can only give you so much. They can only give you a little bit in the time that they have that they're meeting with you. And most times they're only meeting with you for 5, maybe 10 minutes if you're lucky. So make sure you do your own research. Don't let them don't follow blindly. Go in with your questions. Another little tidbit is make sure that you record your sessions. Ask the doctor, is it okay for me to record? Is it okay for me to tape our sessions so that if your partner cannot be with you during the treatment or the appointment, you can let them in on it as through the recording. For those of you that your partner is out of state or overseas in the military, or if your family wasn't able to meet with you. I always tell the doctors, and I record every one of my sessions with the physicians, I always tell them, if you don't let me record, I will call you 100 times to ask you for questions and ask you for the same information that you told me while we were meeting. And the reason I say that is this: cancer is scary as hell. It will make you stop and feel overwhelmed, and it will get you to where your brain will turn off after I'd say 2-3 minutes of talking with the doctor, because of the fact that not only do you feel overwhelmed with all the information that's coming at you, but you're also scared. And when you get scared, our flight or fight syndrome and status jumps in, but there's also the piece of, where you stay stationary and you're answering and you're talking and you're saying, yes, I understand, no problem. But in reality, your brain has already shut down. You're not listening to anything they say. You're just responding to what you think you're supposed to say, like, yes, okay, do you understand? Yes, I understand everything. Where your brain has stopped functioning and you're not listening. So a wonderful thing to do is record your sessions. Just make sure that you let them know that you're going to be recording for yourself and your family. And most of the time they're okay. If they're not, ask them why not. And if it's a big thing for you, then ask for a physician who doesn't have a problem being recorded. Some of the topics that we're going to be talking about during our time together is going to be about body love. And it's so important to understand what's going on with your body. And also the fact that when you are a breast cancer patient, especially breast cancer, most of the time you may need to have, and I don't want to say most of the time, but if you have a mastectomy, then it's so important to understand what's going on with your body and be able to actually make a new connection with your body, make a new connection with how you look. And I have this great picture that says body love, but it's not coming on for some reason. So, but realizing for yourself that you will have a bit of an issue with your body. And since I've been talking about myself and my own cancer, one of the issues that you may have is with the size of your breasts, whether you had a dual mastectomy or a partial mastectomy, or just noticing scars that you have on your body that will make you feel a little more uncomfortable or make you question. I would say if you're having a hard time getting together and accepting your body, then make sure that you talk to either a social worker or a psychologist or your physician and tell them that you are experiencing problems. I do believe that the mind and the body are connected. If your mind is rejecting your body or your body is rejecting your mind, you're not going to heal as well as you should. So make sure that you have this great connection with your body. And sometimes it is sitting there and being able to understand that your life as you knew it will have changed. The minute that you hear the words, you have cancer, your life changed. And you start looking at things differently. Looking at your body differently is no different. It is just getting a more acceptance with it. And part of Cancer Tamer is that we will be doing workshops on body acceptance, body love, and reconnecting with yourself and your spirituality and your body. Another segment that we will be having on Cancer Tamer is what we call Did You Know? And Deborah Barone will be with us to discuss that part of the show. And she will be talking about different aspects of research that is going on, different things that you will need to know, and different aspects of treatment as well as exercises. Which one of my favorite things to let women know is that once you've had surgery, if they have taken your lymph nodes, even one lymph node, then you cannot have your blood pressure or your blood taken from the arm that the lymph nodes were removed, because then you can end up suffering from a condition called lymphedema. And there is no cure for lymphedema. And for those of you that don't know what lymphedema is actually a condition that occurs where your lymph nodes are not working. And if you've had them removed, then now you know why they're not working. But what happens is that your arm will swell. And your arm will swell to the point that it can impede your circulation. And it looks like, and you can tell when someone has lymphedema, their arm will look like if they have massive swelling. And what happens is that once you have lymphedema, you will not be rid of it. And you will need treatment to be able to pull that the liquid in your arm out, or if you have it in your legs, wherever, because there's different places where you can get lymphedema. So make sure that even now, before you have the surgery, get used to saying, no, you cannot take my blood pressure, you cannot take my blood in the arm where you have your cancer has been diagnosed, or on the side of your body. Another aspect of the topics that we will have here at Cancer Tamer is on health and nutrition. And Dr. Anita Nishal will be coming on with us to talk about nutrition and to talk about health. And she will talk about all the secrets that we usually don't get. For instance, I was so proud of myself. I started eating so healthy, and I was eating vegetables and fruits, and that's all that I was eating, and I thought I was doing wonderfully. And after 3 months, when I finally met with her on nutrition, she told me that I was taking in too much sugar because I was doing a lot of smoothies. Well, I didn't think about the sugar aspect of fruit. I just thought, hey, these are fruits. I'm doing smoothies. I'm drinking almond milk. I'm doing all this wonderful healthy stuff. But I didn't realize that all these fruits had the sugar because I was just thinking, hey, it's organic, it's natural, I'm okay. But for those of you that have cancer, the sugar feeds the cancer. So we want to minimize that. And what Dr. Anita will be doing, will be talking about different aspects of food, and she'll talk about all the secrets behind it. Most important, she'll tell you what's wonderful to eat and keep yourself healthy. Another topic that we'll be talking about is relationships. We all need help on relationships, and cancer patients are no different. So we'll be talking about relationships and how to make them work. One of the awful things that I've learned that a lot of women experience is divorce after having been diagnosed with breast cancer or other types of cancers within 5 to 10 years of being diagnosed, and men too, so let me not exclude them. The horrible thing that happens is that our relationships suffer because of these illnesses that we are experiencing. There's so much running around, going from one doctor to another. There's a lot of fear connected. There's a lot of ifs and what, and can I do this or can I do that, or will I be around? And so our relationships suffer. So one of the aspects that I specifically want to address is the relationship aspect of anyone dealing with cancer, so that you can make sure that even though you are dealing with all the ramifications and all the side effects and the symptoms and everything else that has to do with your cancer, you're also making sure that you prioritize your relationship, because without your relationship, that's just one more heartache that you have to do. So, so that's part of what we'll be covering here on Cancer Tamer. Another thing that you can do is if you go to our website at cancertamer.org, you can also provide us with some questions that you might have on relationships, on nutrition, on treatment, on different aspects of things that you can do, like acupuncture, sound yoga, yoga itself. And you can ask us for that. And if you have a specific um, if you have a specific treatment that you would like us to address, then by all means call us up and we'll try and find a physician or a clinician that we can bring onto the show, and they can talk all about that. But you're welcome to ask your questions at cancertamer.org, and we'll be able to see those. So for those of you that are just tuning in right now, and for those of you that have been with us all along, Cancer Tamer is a new way of looking at cancer. It's understanding that cancer is not an outside force attacking us, but it is an inside force that is within us. It's a part of who we are and a part of our DNA for some of us, because some of us have been genetically tested and you might have a predisposition. But just because of genetic testing, and here's a piece of genetic testing that you need to know. People will turn around and say, oh, well, you need to go and get genetically tested to see if the cancer gene runs in your family. And even though, and that's a whole nother issue, and we'll be bringing in a genetics therapist to talk to you about that. But the piece that I want to let you know with genetic testing, just because you come and have a genetic test and the genetic test says, yes, you are, one of your genes or several of your genes have come out positive for cancer, that does not mean that you will get cancer. That just means that you are at higher risk. So if you have cancer and you ask your daughter or your son to get treated and they are carrying the gene, that does not mean that they will get it. That just means that they're a little at higher risk and more susceptible to getting cancer. And so they need to be watched a bit closer. Also, if you have some kind of a genetic mutation in your system, in your DNA, then you need to be test it more frequently, and that's part of your insurance. The one thing that I would say, here's a little tidbit that you should know. Your doctor is not in charge of your insurance. Therefore, if your doctor turns around and says, oh, well, your insurance company is not going to accept that or not going to deal with that or not going to approve it, they're not sure. They might have been dealing with your insurance company, but what I found is that if you call your insurance company and you say, what do I need to get? How does my doctor need to phrase it? What exactly do they need to say so that this treatment or this medication or these supplements can be accepted? And your insurance will then turn around, tell you what they need, and then they'll be able to do it for you. That's been my experience. Some people have not experienced that. So again, your doctor is not your insurance company, so make sure that they stick to medicine and you talk to the insurance company. Also, like I mentioned before, for someone turning around and getting information from the internet for you, you can also assign a loved one, a friend, to be able to deal with the insurance company for you. Insurance companies tend to have a lot of paperwork, a lot of red tape that you need to jump through, and it's hoops that you will have to learn how to dance around so that you can get not only the treatment you need, but the medication and the supplements and all the other little items that you need, such as a customized sleeve, a lymphedema sleeve, compression sleeves, high blood pressure equipment, or whatever else you might need. So definitely always talk to your insurance company and get them to put it in writing. Most insurance companies will have what they call case managers. Get your insurance company to assign one person to your case. Have them give you a case manager. And then this way, you can deal with that person in particular, and that person can be your advocate with everyone else in the insurance department. Also, for those of you that are in managed care or within a hospital facility, double check and see who your nurse navigator is. A nurse navigator helps you navigate through cancer, helps to provide you with information. I know my nurse navigator knows my telephone by heart now because I've always called her and said, I have a question for you. The minute she hears that, she knows she'll be with me for at least a half hour, answering questions that I have researched, that I have, and also addressing some of my fears. Another wonderful person to have on your side is talk to the social worker in your hospital or who is part of your medical care. Your social worker will be a godsend for you. She will be able to help you navigate some of the information and some of the situations that will come up during your time with this crazy life of cancer. So please feel free to ask questions, and don't forget, you have to advocate for yourself. If you're waiting for somebody else to do it for you, you're going to be waiting till hell freezes over, because they won't do it for you. They can't do it for you, and they may not do it the way you think it should be done. Therefore, do it for yourself. And if you say you're not used to advocating for yourself, or you're shy, or you're not sure what to ask, that's okay. You're going to learn, and you'll be doing your research. If you're not sure what to research, by all means, get in contact with us. But I would highly recommend the American Cancer Society and talking to them, and they have people there 24/7 who are able to help you, and they're always wonderful. I've been known to call them at 3 o'clock in the morning when I haven't been able to sleep and start asking questions. So they're available for you 24/7. Other organizations may also have individuals that you can talk to, and if you need to, by all means, please talk to a psychologist, a psychiatrist, to be able to deal with some of the fear that comes up with cancer, and being able to just talk about what you think that you would like in your life. So my name is Dr. Charlie Ferrer. I am a cancer tamer. I have breast cancer, been diagnosed with breast cancer, and have gone into surgery twice now, because apparently my body does not like the stitches. And so I am here hoping that I can help educate, help inform, help give you and share with you some of my own experiences, as well as ways for you to be able to navigate this crazy cancer journey that you're on, and be able to do it in a better mindset, in a more happy place. And it's hard to say happy, but hey, just because you got cancer doesn't mean you can't be happy and you can't have a wonderful time and you can't enjoy life. That is the one thing, most of all, that you really should be doing. It's enjoying every minute. And it's, that old song about live like you were dying. It is one of the songs that I love, and I can't remember the singer that has it, but I love the words behind it, whether you have cancer or you don't. It is living like you won't be around forever, because it makes you start looking at more aspects about getting up off the couch and going out and actually living your life instead of waiting for it to come to you. And that, I guess, is what Cancer Tamer is all about. It's about taming life, about taming cancer, and about taming some of those negative aspects of yourself that are stopping you from being able to do what you want, how you want it, when you want it, and enjoying life to the fullest. So I'm Dr. Charlie Ferrer. I'm the founder of Cancer Tamer. I'm a clinical sexologist, and I hope to be talking to you often because I'll be on your set every week, bringing you more and more information and bringing you all the all the physicians and clinicians and friends that I make throughout this crazy journey so that they can give you just as much information as I have. And as much information as you need. So, thank you for listening and have a wonderful day. Remember, Cancer Tamer, because you shouldn't be at war with your body.